Hello everyone, so we are from Group 2. In this video, we will dive into smallpox vaccination testing towards the Native American.
An isolated population of Native Americans is considered for testing of the efficacy of a vaccine for smallpox. The population has never before been exposed to this illness, which often has been fatal to groups when they have been afflicted and when they were previously unexposed.
The central issue for this case study is that the consideration that testing the efficacy of smallpox vaccine on this isolated population could bring valuable information about the effectiveness of the vaccine. However, there are ethical concerns with testing a vaccine on an isolated population of Native Americans, which can cause certain harm to them. So, we think smallpox vaccination testing towards Native Americans should not be proceeded to the fact that it has been known that smallpox can lead to fatality towards those who not been exposed to it yet.
I'm going to share a similar case to the smallpox vaccine. In 1932, there was a case where the researcher put others at risk of infection, which was called the Tuskegee syphilis study. Initially, before the 40-year unethical study was conducted, only 399 participants were infected by syphilis. Due to the research and refusal to give proper treatment to those who are affected, at least 28 died and perhaps more than 100 men faced the same fate. And why do we bring this up? Because ethical research is paramount. We must learn from the Tuskegee tragedy to ensure such exploitation never happens again.
For the faith test, according to the Islam, we have to preserve our life. By taking care of the spiritual in the human soul is important to the point that the human being is not motivated to inflict harm to oneself. Since vaccines were proven in preserving millions of lives by reducing mortality, Islam not prohibit Muslims to take vaccines since it helps with their lives.
So for the second test of the faith test, where we have Buddhism, where they believe on the ahimsa, which means of non-harm to all living beings. This concept is central to the Buddhist teachings, where it is implemented by the core tenet of the five precepts. In behalf of the Native American, the vaccine testing should not cause any harm to the individuals or the community of the Native American itself. Should be conducted with compassion and no exploitations to the Native Americans. For the third test of the faith test, where we have Hinduism, where they believe on Dharma, which is the duty and the righteousness. This is to encompasses the idea of fulfilling one's duties and responsibility righteously. In the context of the testing of the vaccines towards the Native American, the consideration of Dharma might be involved in this weighing the duty to protect and preserve life against the potential risks and the benefits of the vaccines. For the fourth test of the faith test, where we have Christianity, where they believe in stewardships and responsibility. In Genesis chapter 1, verse 28, the biblical concept of human having dominion over creations implies a responsibility to the power and resources wisely and justly, and not to exploit any harmful, vulnerable population under one's care.
We've also conducted a harm test for this experiment. So the first party that are affected in this harm test is Native American themselves. There's two opinions regarding this harm test. The first opinion is to agree with the vaccination, and the second opinion is disagree with the vaccination. So for the first opinion, there's also a pros and cons. For Native American, the pros is that it will prevent the spread of the smallpox disease, and the second one is they would be educated regarding the vaccination. However, the cons for this opinion is would actually lead to deaths severely since they have never been exposed to smallpox before, and we also not respect those who choose not to take a vaccination. However, if they choose to stay with the second opinion, there's also pros and cons. So the pros is it will not put them on the death risk, and we will also respect opinion of those who choose not to take a vaccination. The cons, on the other hand, is the herd immunity of a community couldn't be created effectively, and it would also keep indigenous people in a state of ignorance.
Next, for the research and healthcare professional, if they agree to the vaccination, it will lead to the funding of research, which will lift the burden of research costs. Not only that, it would also allow for trust to be built and cultivate among the community of scientists and healthcare providers. However, the downside would be that it is very risky, as failure of project and funding is quite probable, if not highly bound to happen. Furthermore, it can prove to be a slippery slope to conduct this kind of experiment while also keeping the cultural sensitivity and the needs of participants effectively, as more often than not, research and healthcare providers do not usually give a thoughtful input and output while collaborating with indigenous people. But what if they oppose the vaccination? Well, they will be able to save up their fund and invest it on other much more human projects, studies and whatnot. Plus, any potential clashes of opinions that might come to fruition due to the cultural difference would be prevented and thus create a much more fostering relationship between indigenous people and them. But it is to be noted that this option would mean that the effectiveness of the vaccine on the Native American population remain vague, which could lead to an ominous outcome such as health downfall. Besides, the lack of proper communication between the community and indigenous people could contribute to further misunderstanding, isolation, and lack of healthcare literacy.
We've also conducted a professional test. So the first profession that related and we take into consideration for this test is the Coalition for Epidemic Preparedness Innovation, also pronounced as CEPI. So what is CEPI? Basically, if one wants to actually produce a vaccination, they must go through along with CEPI. So CEPI is actually some organization with a global partnership. So since CEPI is basically an international body, it does not have its own regulation. However, it is expected to adhere to the international regulation. In these cases, we are talking about Helsinki Declaration. There's this one principle in Helsinki Declaration called the Principle of Beneficence in Helsinki Declaration, where it basically obliges the investigator to maximize the benefits and minimize the harm that may occur during the experiment. It basically relies on the Hippocratic principle of non-maleficence, also known as do not harm.
The NET's character is Food and Drug Administration, more commonly known as FDA. It is a regulatory agency in the United States that is responsible for protecting and promoting public health through the control and supervision of food safety, dietary supplements, prescription and over-the-counter medication, vaccines, biopharmaceuticals, blood transfusion, medical devices, electromagnetic radiation-emitting devices, veterinary products, and cosmetics. The FDA plays a crucial role in ensuring the safety and efficacy of vaccines. Before a vaccine can be approved for public use, it undergoes rigorous testing and evaluation by the FDA through clinical trials to assess its safety and effectiveness. The FDA reviews data from these trials to determine if the vaccine meets the necessary standards for approval. Once approved, the FDA continues to monitor the vaccine safety through post-market surveillance to identify and address any potential issue that may arise. This process helps to ensure that vaccines distributed to the public meet high safety and quality standards. Thus, it will be consistent for them to be careful in considering whether or not conducting this experiment is crucial. The adherence to Helsinki Declaration will be their main priority too, as it is a set of ethical principles developed by the World Medical Association to guide physicians and other participants in medical research involving human subjects through an ethical lens.
For United Nations, the International Covenant on Civil and Political Rights have stated that the covenant deals with such rights as freedom of movement, equality before the law, the right to a fair trial and presumption of innocence, freedom of thought, conscience and religions, freedom of opinion and expression, peaceful assembly, freedom of association, participation in public affairs and elections, and protection of minority rights. And for World Health Organization, WHO, the WHO smallpox immunization policy in 2013, and those who required the vaccine was reserved for the following at-risk group, which includes immediate contacts of cases, healthcare workers, and first responders who have direct contact with symptomatic patients.
As for the publicity test, a proposal suggests testing a new smallpox vaccine on an isolated Native American community. This approach raises serious concerns. We are not comfortable publicly publishing or announcing our actions by subjecting the Native American populations to such approach. This is because the risks are too high and the payoff is too low for it to be considered not only ethical but also necessary. After careful consideration, the final decision is to not proceed the experiment with utmost regard for the well-being and autonomy of the Native American population. The decision was made after considering all the tests made, which are harm test, faith test, professional test, and publicly test. Prior to preliminary decision, this was made as a cautious approach regarding this matter. This conclusion was made as the trial is consistent with the moral values of respect for autonomy, non-maleficence, beneficence, and also justice.
Lastly, we would like to thank you to Dr. Muhammad Zuhairi bin Saiman and other lecturers involved in these courses for their invaluable guidance and support.